Hey, it's Jess from Head to Toe Health. I'm going to run through an exercise to help with the lumbar and thoracic mobility. It's really good if there's any disc pathologies involved. So you're going to get a rolled up towel and place it under the lower back. So coming down slowly, making sure that that's a comfortable height. If that's too high, please go and get a smaller towel and roll that one up. All right, so from here, that towel's down quite low for me. And what I'm going to do is I'm just going to walk down the towel, just section by section, just a slight amount. So I'm pushing one hip down and then the other as I go. So once I get up to my rib area, so where I can feel the ribs against the towel, I'm going to walk back up. So it'll create a nice little massage in through those lower back muscles. But what it'll also do is mobilize through the lower back. Now, what's really important here is to use some visualization. So as the spine goes into more extension or back bending, this is going to push the contents between the spinal vertebra, so the disc contents, forward. It's going to encourage that movement of the fluid forward. So if you imagine that happening as you do this exercise, you'll get more change out of it. We know that imagery really does support our physiology and how we can improve the effectiveness of certain exercises. So make sure you're bringing in that imagery with you as you go. Really focus on the benefits of the exercise. So you can go up and down, walking up and down about 6 times through the lumbar spine. And then, if it's indicated, you can bring the towel up into the thoracic spine. So the thoracic spine goes from where the lower ribs are up to the top ribs. So again, we're going to walk the hips down so we can get that thoracic area down the towel a little bit more. So you need to just use your shoulders a bit more to create this movement. But again, we're focusing on that disc material moving forward. So we're opening up through the thoracics. So if you find that you get to a particular area in the thoracic spine or the upper back where you have restricted extension, so you feel like you're pushed a bit further, it's maybe a bit more uncomfortable to stay in this position, then I'd encourage you to remain there for a few seconds, maybe 10 to 15 seconds. What you can do also, you can put your arms out to the side to open up through the chest, and then keep going with the mobilization. So again, we're looking for about 6 reps up and down through that thoracic spine.